Thank you for joining the Justice and Mental Health Collaboration Program Category 2 Law Enforcement Planning Grantee FY17 Orientation Webinar. My name is Nikki Smith-Key, and I will be facilitating this webinar for today. I want to say a huge congratulations to all of our grantees who were able to join us for today and who were awarded with this JMHCP grant. Olivia, the PowerPoint isn't showing?
Yeah, it should be. Hold on, I'm loading it again. Anybody who's not able to see right now. Is that working?
Yes. So for today's webinar, we will provide a brief overview of the Category 2 Strategic Planning for Law Enforcement and Mental Health Collaboration Program. We will discuss our JMHCP Technical Assistance Strategy for the year. We will share with you details of a new framework we have developed, and you will hear from a current grantee regarding their JMHCP grant-funded program. Our presenters for today, we have Maria Fryer, who's a policy advisor for the Bureau of Justice Assistance. Unfortunately, Jerry Murphy, who is the director of the law enforcement program, was not able to join us. My name is Nicola Smith-Key. Everyone calls me Nikki, and I'm a senior policy analyst at the Council of State Governments Justice Center. We also have joining us Talia Peckerman, and Talia is a policy analyst on the law enforcement team, and our current Justice and Mental Health Collaboration grantees, Linda Allison and Gary Anders, who's joining us from Alamance County. A few housekeeping matters. We do have a question and answer session towards the end of the presentation. You can type the question into the Q&A panel on the bottom right-hand corner of your screen. If your question does not get answered during the webinar, please follow up via email after the event has ended, and we will be sure to get back to you. If you have technical or audio problems during the webinar, please call support at 1-866-229-3239. On November 1st, 2017, we conducted a more general orientation webinar for all FY17 JMHCP grantees, where we provided an overview of the JMHCP program, discussed strategies and tools for technical assistance, and discussed budget and grant management and the performance measurement tool. On your screen, you can find a link to the recording of that webinar, where you can also download the full slide presentation. At this point, let me turn things over to Maria Fryer, who will bring greetings on behalf of the BJA and will share with you what her role is at the BJA and provide a brief overview of the Justice and Mental Health Collaboration Program. Maria?
Thank you so much, Nikki. Hello, and good afternoon, everyone. Again, on behalf of the Bureau of Justice Assistance, I would like to congratulate you on a job well done and welcome you to a very special group of grantees creating important change at the local and state level. I am, again, Maria Fryer, a policy advisor at BJA, and I oversee the Justice and Mental Health portfolio. And this portfolio encompasses a lot of different things, a lot of different activities, the entire Justice and Mental Health collaboration process, from the very beginning of the solicitation posting right up through recommended grant awards. I also intersect with other federal agencies on justice and mental health, and I oversee a number of national training and technical assistance cooperative agreements, such as the one with the Justice Center and We work collaboratively together to help grantees in the best way we can. Some of the examples of activities in my portfolio include, of course, JMHCP, of course, and also the Police Mental Health Collaboration Toolkit, other justice and mental health policy, the Stepping Up Initiative, and also national initiatives to improve police-based response to people with mental illness. And I oversee the programmatic aspects of your grant award, such as the goals, the objectives, deliverables, evaluation, and again, training and technical assistance with the Justice Center. So, but for today, we're going to talk, of course, about JMHCP, so a little bit about that. The Justice and Mental Health Collaboration Program, otherwise known as JMHCP, supports innovative cross-system collaboration for individuals with mental illness or co-occurring mental health and substance use disorders who come in contact with the justice system. A major goal of JMHCP is to facilitate collaboration among criminal justice, mental health, and substance use treatment systems to increase access to mental health and other treatment services for individuals with mental illness or co-occurring mental health and substance use disorders. JMHCP is authorized by the Mentally Ill Offender Treatment and Crime Reduction Act, or MIOTCRA, and the Mentally Ill Offender Treatment and Crime Reduction Reauthorization and Improvement Act. It was reauthorized by the 21st Century Cures Act in December of 2016. So with that, I believe I'm going to hand it back over to Nikki, since Jerry's not with us today. Is that correct, Nikki?
That is correct. Thank you, Maria. So I'll just take a brief moment to tell you just a little on who we are here at the Council of State Governments Justice Center. We will be your technical assistance provider throughout the duration of your grant. The Council of State Governments Justice Center, also known as CSG Justice Center, is a national nonprofit, nonpartisan membership association of state government officials, and we represent all 3 branches of government and provide practical advice for the best available evidence. Since the onset of the JMHCP in 2008, CSG Justice Center has been the sole provider of the TTA work for more than 435 grantees, with at least 50 of those grantees being law enforcement agencies. The team here at the Justice Center that will be providing you with technical assistance includes Jerry Murphy, who I mentioned earlier, who's a law enforcement program director. I am Nicola Smith-Key, and I'm a senior policy analyst. We will also have working with us Cynthia Kimmelman DeVries, and she's a deputy director for the Behavioral Health Division, and 3 policy analysts, Deirdre Assey, Laura Fabius, and Talia Peckerman, will be your technical assistance providers. Over the last few years, there has been an emphasis in the BJA on police mental health collaboration programs. And we have seen an increase in the number of grants being awarded to law enforcement-based programs. In 2014, there were 7 grant awards to law enforcement agencies, and it more than doubled in 2015. This year, the BJA created a new category for law enforcement-based grants, awarding a total of 25 new grants, in addition to the 10 law enforcement grants in Category 3. The Category 2 JMHCP grant is a 12-month award for up to $75,000 for strategic planning for law enforcement and mental health collaboration. This is the very first cohort of Category 2 grantees, so again, congratulations to you all. There were 25 awards made, and we have a few states having multiple awards, as you will see on the map. You will see we are currently working in quite a number of states, and throughout our time, we will work towards linking grantees within and across states. The Category 2 grant program has 4 key areas of focus. Grantees are expected to design their community's law enforcement mental health collaboration strategy by conducting a comprehensive agency assessment of policy and practice, developing an agency training plan, building and maintaining a data collection system, and partnering with mental health and the community for a more appropriate response to people with mental illnesses. So what will your JMHCP technical assistance look like? We will have a couple opportunities to meet in person. First, there will be a strategic planning session that is mandatory for all grantees. There will also be an orientation and conference. For this event, there must be representation from law enforcement, from your mental health partners, and a staff responsible for management of the grant. We will also provide distance-based technical assistance. Each grant program will be assigned a technical assistance provider. This is a CSG Justice Center staff who will work closely with you to meet your program goals and objectives. Just as a reminder, for this year you will be working with Deirdre Assey, Laura Fabius, and Talia Peckerman. We will facilitate monthly check-in calls. During these calls, we will be discussing your progress and or challenges and responding to any requests you may have. A large part of our technical assistance we provide is also focused around peer-to-peer learning. With that in mind, we will also help to facilitate web-based learning communities, virtual cohort-based meetings, and linking grantees to our law enforcement mental health learning sites or other JMHCP grants. We will also use various tools that will help guide you through the JMHCP planning program. One such tool is the planning guide, which we developed based on our years of work with JMHCP grantees. This guide works in accordance with the Police Mental Health Collaboration Framework, which we will discuss more in detail shortly. The planning guide will help TA providers to understand the status and progress of your program. The guide is activity-based and will require you to complete sections on a monthly basis that will be reviewed by your TA provider and discussed during your monthly check-in calls. Included in the planning guide, we also have a logic model or logic models for grantees to complete around different elements of your program. For each logic model, you and your team will be able to articulate your overall program goals and measurable objectives based on your grant narrative. You will think about the resources you have in place, what activities are needed to accomplish goals and objectives, what results you hope to achieve once activities have been accomplished, and the outcomes you hope to see in the next 1 to 3 years. This will help grantees visualize the purpose and scope of the activities, resources needed, and expected outcomes. There are a number of resources that we will tap into while we are with you throughout your 12-month award. The Justice Center has a number of publications available on our CSD Justice Center website, and your TA providers will be able to provide you with links to these publications. The Police Mental Health Collaboration Toolkit, which Maria mentioned earlier, it is also housed on the Bureau of Justice Assistance webpage. This is an online toolkit which provides a host of resources around planning and implementing your police mental health collaboration, training for your police mental health collaboration, management of your PMHC, and measuring performance. I mentioned earlier about making connections to our law enforcement mental health learning sites. This is a national effort that started in 2010 in an effort to expand the knowledge base for law enforcement agencies interested in starting or enhancing a PMHC. The Justice Center, with the assistance from a team of national experts and the U.S. Justice Department's Bureau of Justice Assistance, selected 6 police departments to serve as national law enforcement mental health learning sites. And those are on your screen: Salt Lake City, Los Angeles PD, Houston PD, University of Florida Police Department, Madison Police Department, and Portland, Maine Police Department. To learn more about what we do and the services we provide, please visit our website at csgjusticecenter.org. At the end of the presentation, we will display all of our contact information. Please feel free to email the appropriate person for additional information as it pertains to technical assistance issues. As a reminder, we will be emailing out this webinar recording, including a link to the slides, as well as posting a link to the recording on our webinar page in archive form. Our technical assistance and our planning guide is guided by the Police Mental Health Collaboration Framework. This is a new resource that we have developed for the field. The Police Mental Health Collaboration, also known as PMHC Framework, is intended to assist local leaders, including elected officials, law enforcement and behavioral health agency executives, and their senior personnel who want to begin or improve the outcomes of their police mental health collaboration program. By answering these 6 questions, is our leadership committed to the police mental health collaboration? Are we following clear protocols to respond to people who have mental illnesses? Are we providing staff with quality mental health and de-escalation training? Do we have the resources and service connections for people who have mental illnesses? Do we collect and analyze data? Do we have a process for reviewing and improving performance? By answering these questions, you will help improve public safety and public health in your community by increasing connections to behavioral health, resources and treatment, and expanding linkages options. You will also help to reduce the repeated encounters with law enforcement, reduce arrest when appropriate, and reduce injuries to both officers and people with behavioral health needs. We're going to delve a little more into the questions that appear in the framework, and my colleague Talia Peckerman will also assist in this section. There will be multiple leaders involved in the development and maintenance of your police mental health collaboration program. For example, elected officials, police executives, police managers, behavioral health directors, and behavioral health program coordinators. Buy-in and support from all leaders is critical for ensuring that this collaboration with behavioral health agencies is effective, successful, and sustainable. Indicators for strong law enforcement leadership include the following criteria. Are leaders demonstrating that the police mental health collaboration program is an agency priority? Are leaders working with behavioral health agencies to improve coordinated response and information sharing practices that support your PMHC program? Are leaders providing appropriate education and training to agency leaders, officers, deputies, or other law enforcement personnel, as well as cross-training behavioral health professionals? Are leaders measuring the performance of the PMHC program and employing a reporting process that enhances buy-in, informs policy changes, and promotes accountability for results? It is equally important to ensure that everyone who is involved in responding to people with mental illnesses knows and understands their roles and responsibilities. To that end, it is critical that we have policy and procedure documents in place that can guide key personnel. A key part of this is to conduct a process flow to identify the key decision points for officers and behavioral health service providers, as well as the disposition alternatives. This is of critical importance whenever there are cross-agency interactions. These are some questions you should be thinking about as you put together or improve your policy and procedure documents. Are protocols written? Are roles and responsibilities clearly defined? Are the protocols comprehensive? Do they cover every step of the encounter with the person with mental illness? Do your protocols include clear directives on the sharing of information? Your agency should also have a defined process for decision-making on modifying protocols and reviewing periodically whether the response model actually meets community demands. Law enforcement agencies must determine which personnel need knowledge and skills training, the number of hours, and the frequency of refresher training. We impress on all of the agencies that we work with that training is extremely important, but we must also bear in mind that the development or enhancement of a police mental health collaboration is certainly more than just training. Training should be comprehensive and aligned with staff decisions and should be delivered by qualified experts such as law enforcement personnel, mental health personnel, and or people who have mental illnesses, family members, and advocates. At this point, I'm going to turn over to Talia to discuss the other questions in the framework.
Thank you, Nikki. All right. Okay, thanks, Nikki. Here we go. So having the necessary community resources and treatment options in place is an important piece to a successful PMHC. The first task is to conduct an inventory of your community's current resources and service connections to determine if they meet the full set of needs of your population. Once these resources and service connections are identified, determinations can be made of what is lacking. You can start seeing where some of the gaps are. Without the right and sufficient resources and service connections, officers are left with few alternatives but to arrest. However, if these resources are available, then officers have greater opportunities to de-escalate interactions, divert people to behavioral health agencies, and ultimately improve outcomes for people with mental illnesses. To have a complete understanding of the population that you are working with, their needs, and whether your responses are effective, your jurisdiction must establish a strategy for collecting and analyzing data among the different agencies. Each PMHC should determine the specific goals and objectives that will guide the data collection process and strategy. Then, law enforcement and behavioral health partners can identify what information is needed to demonstrate whether progress has been made and determine the best method to collect these data. Reliable data are essential for demonstrating PMHC activities and performance, ensuring that scarce resources are effectively managed, demonstrating your successes to government decision makers, requesting funding, and garnering support from behavioral health care providers as well as other community stakeholders. Here are some examples of appropriate and relevant data that your agency should be collecting. Police process measures, for example, how many officers have been CIT trained? You should also be collecting data on police operational measures, like the number of mental health calls for service. On frequency of police dispositions, and we suggest that that be broken down by demographics, including gender, age, race, and ethnicity. And lastly, on police use of force and injury. When reviewing and seeking to improve performance on the PMHC, refer back to key performance measures and desired outcomes from the introduction to see if you are succeeding and where you need to improve. It is not enough just to collect and analyze information in a given community. Rather, leaders should regularly review this information to determine where improvements are still needed. This is what the process for reviewing and improving PMHC performance looks like. 1, leaders should prioritize and identify agency infrastructure and coordination needs. This process needs to be coordinated across law enforcement and behavioral health agencies. Also, leaders should use their top-line performance measures and desired outcomes to determine where there are breakdowns if those outcomes aren't being met. Now I'm really excited to introduce our guests from Alamance County. Alamance County is a FY16 JMHCP grant recipient. While the scope of their grant is quite different from yours, as we mentioned earlier, your grant category is very new, we think that hearing from them would really help you to understand the importance of the planning stage in developing, implementing, and sustaining PMHC-related programming. Alamance County has a comprehensive PMHC program which functions under their Stepping Up initiative. The Stepping Up initiative is an initiative to reduce the number of individuals with mental illnesses in jail. And it includes participation from a number of their stakeholders. But this all didn't happen overnight. One thing that sets Alamance apart is their thoughtful and intentional focus on planning. They have established committees, take the time to hire the right people, and are open to learning from others in their field. They do this in order to develop the right programming which best fits the needs of their jurisdiction and addresses their stated goals. Without further ado, I will now turn things over to Linda Allison and Gary Ander from Alamance County.
Thank you, Talia, for hosting us. Can everyone hear me okay? Can everyone hear us okay?
Yeah, we got you.
Yes, we can.
Yes, you're good.
Gary and I are the Stepping Up project coordinators for our grant and for the initiative in our county. Just so you have a little information about who we are and where we are, Alamance County is one of 100 counties in North Carolina, and if you looked at the map, we are smack dab in the middle of the state. If you needed to make a reference point, we're about 60-mile radius of 4 major universities, UNC, Duke, NC State, and Wake Forest. There you go, basketball, football fans. Our county has 7 jurisdictions. That would be 6 local municipalities or law enforcement agencies along with a sheriff's department. And we are coordinating with all of those jurisdictions as part of this grant. Gary, next slide, please.
So the reason we have 2 Stepping Up coordinators in Alamance County is because Linda and I are job sharing. And we're both retired. I'm from the mental health field and Linda from social services. So our initial goals that are in our BJA grant, number 1 are about developing a collaborative community response to mental health crises. And this is a broad community response developed between law enforcement and the broader community, including our regional hospital, our mental health services and administrative agency, and the array of support services need to keep people from recidivism. Probably our major component is training, and as you see there, we want to dramatically increase the CIT trained professionals in Alamance County. That's law enforcement and EMS primarily. in CIT. We want to increase the number of criminal justice personnel trained in mental health first aid. And we want to increase the number of mental health and substance abuse and other related professionals trained in mental health first aid as well. Certainly, CIT and mental health first aid are major training components. But we also want to increase the number of the law enforcement continuum relative to the court system of attorneys and court personnel and jailers in how being trauma-informed improves the criminal justice system responses. So training, major component. In addition, we really want to work on crisis response and diversion. So right now we have a crisis center that is open 12 hours, and we want to figure out how we can expand the hours of that crisis center. Our hope is to establish a 24/7 diversion and restoration center so that we have an additional place for law enforcement to take folks, and so they have choice. In addition to this, we also really want to work on expanding our service capacity, including mental health services, substance abuse services, housing, employment, and all those community services that support people staying out of the detention center. Next slide, please. So we also are working on these additional, which I call these are simply stepping up goals, and you probably have seen these before. Clearly, we want to decrease the number of people with mental illness and or co-occurring mental illness and substance disorders entering the jail in the first place. We want to decrease the number of days that these folks stay in jail. We want to increase the number of these folks that are actually connected to services and supports as they leave jail and have reentry plans established for them. And of course, we want to reduce recidivism. And as I speak about these goals, these are really things that we want to be tracking with data collection. And we have just, after our first year, really have gotten now baseline data on all these points in order to start tracking in the next couple of years. So next slide, please.
So we were asked to share with you how our grant award, and as Talia stated, we were awarded our grant in October of 2016, so we're just starting year 2 of a 3-year grant, has helped us, and it certainly, this grant award has allowed us that we believe have a greater impact and progress more quickly than we otherwise would have, because the goals under our grant are key components of the work that we had begun as a stepping up county. This grant award has helped us to build momentum around all these issues that Gary has outlined for you, primarily around jail diversion of the mentally ill and mentally ill substance users in our county. It also has allowed us to spend thoughtful and diligent time developing and planning our activities. We went through a process and actually a tool that was required, which was the Planning and Implementation Guide. And I can honestly say that that was a very useful process. It stretched us and beyond what we normally would have done on our own, and forced us to look more intentionally at lots of areas such as risk assessments and things that we really had not thought a lot about, but now are becoming a part of our processes. It is a very comprehensive process, but I assure you these are questions that need to be asked. It also helps us to set goals and develop a database. You know, you try to tell your story, most people want to know, well, show me. What difference has that made in your county? So we are just now finalizing, after many, many months, our baseline data to enter this year too, and this is one thing that the grant again has kind of encouraged us and pushed us in the direction of doing, which is very critical for our work. Examples of some of the technical assistance that we've received, as was mentioned earlier, the peer-to-peer learning. It always helps to hear from others, similar sized counties or other law enforcement professionals or people that you share commonalities with. So we reached out several months back to our grant consultant, to Talia, and asked for guidance as we began to put together our Justice Advisory Council. We wanted to hear from some counties who had already done that work and gone down that road that she could recommend, and she did that to us, and we reached out to them and were able to gain very relevant information to use as we tried to draft bylaws for our Justice Advisory Council. Another area that we struggled in some ways was in the data collection and being on the webinars and hearing from others who had gone before us and had already worked out lots of these issues was very, very helpful. So I cannot stress enough how critical it is, the support that you receive, the online resources, the fact that you can reach out to other counties who may have asked the same questions before and already have come to the conclusions is very helpful. Next slide, please.
So we'd like to talk a little bit about our accomplishments to date, and I guess when we put these down on paper, we were both sort of surprised because we actually have had quite a few accomplishments. In over a year now, we were funded, coordinators were funded through some funds through our Sheriff's Department prior to getting the grant. So we started prior to last September. So we've had more than a year to work on these things. But under community collaboration, we've actually done a lot. We've had a great leadership team made up of both government leaders, law enforcement, and community service representatives as well, about 14 of those folks. That has actually led to the development of our Justice Advisory Council, which actually just met this morning for the first time, and there were over 30 people at that, and it has an interesting setup in our community that we could share later. But we have every chief from every law enforcement agency. Again, we have our county manager, we have our county commissioner, we have a psychiatrist, we have key people, the district attorney in that group, and it's a decision-making group that will make recommendations both to government and to community agencies as we move forward. Over a year ago, in September of 2016, we held a community dialogue with about 80 people in the community from all segments, including consumers, and really spent that day doing a gaps and needs analysis for Alamance County around this particular issue. As a result of that, we developed 4 subcommittees, and they include a training and community education subcommittee, a recovery and reentry committee, screening, assessment, treatment, and data, and then a community capacity and sustainability committee. We also are continuing to make room for a lot of community input by having a biannual, twice a year, is that semi or biannual, community task force meeting, so that we continue to get lots of input from our community and make sure that there's good buy-in. Under training, we feel really happy about the work that's been done over the last year. We've had 76 law enforcement, and that's actually, we had 73 law enforcement and 3 EMS folks complete CIT this past year. As you see, we've had 237 folks, including probation and all our detention officers and other professionals trained in mental health first aid. We're really happy about that. Again, CIT and mental health first aid is kind of our first level of training, and we really want to continue to push that. Under crisis and diversion, we created a couple of new positions with, and this is important, with local funding. We have a full-time co-responder in our primary municipal law enforcement agency. And we've created a position with local funds for a detention center social worker. And just be aware that we've never had a social worker in the detention center before. So that's a big deal. And I think that this big pie in the sky that we're looking forward to in Alamance County is this diversion and restoration center. And we really think that that's going to become a reality. The county has dedicated a building. We have funding commitments from 2 partners, including our regional hospital and our local mental health administrative agencies. And we've just started working on really kind of a 5th subcommittee, I guess. You call this a planning work group to really implement the diversion center, as well as what we can do in the interim period between now and when we have a diversion center in place. The other thing that I think that is really important is relative to data collection that Linda talked about is, you know, we have now established this baseline data. And again, we recognize that in order to continue for sustainability and for funding, we have to show people that we're doing good work and we're making progress. And I think that data collection will be helpful there.
And one additional accomplishment that's not on the screen, but we would like to add, we actually had a dream come true in that we actually took a team this past week to San Antonio, Texas, to the Bexar County facilities there to see their diversion programs in depth. We spent 2 days in San Antonio, and we carried a team of 16 individuals. That included most of the ones that Gary mentioned, our sheriff, chief deputy, county manager, DA, psychiatrist, mental health professional, et cetera, hospital staff, and we gathered lots of wonderful information that will help us in the planning and rollout of our diversion center. So again, that was just something we walked away actually with plans in place. The sheriff is already, we've been back, just got back late Friday, and they are already working to implement a mental health detention team of officers in the center and possibly even a patrol unit. So that's how things happen when you have all the right players at the table together. Lots of good things can happen. Next slide, please.
This is our contact information. If you would like to contact us, we'd be more than happy to talk to you about some of the work that we've done here. We've been blessed in that we do have great leadership here. We have a great collaborative county, which has certainly set the foundation for the work that's been accomplished today. And again, thanks to Talia as our TA person, who's been both supportive and very helpful with the work. We'll turn it back over.
Thank you, Linda and Gary, for sharing with us on the work that you're doing in Alamance County. Always exciting to hear from you guys. A special thank you to all of our presenters. At this point, we will open up for question and answers. Just as a reminder, to ask a question, please type the question into the Q&A panel, which is on the bottom right-hand side of your screen. Talia and Laura will be moderating this section. We will do our best to answer as many of your questions as possible in the time remaining. Again, if we run out of time, please do email one of us using the information provided on the contact information slide. Talia?
Hello, hi, this is Laura Fabius. So question for Sarah. You mentioned 2 events, a strategic planning meeting and an orientation and conference. Who from our team would come to these events?
So for the 2 events, the strategic planning meeting is really focused on bringing the law enforcement partners as well as the mental health partners. And you're really going to get a great overview of this event, of the planning process you'll have over the course of the year, and it will really dive into some of the police mental health collaboration framework pieces. So we recommend you bringing really a change leader within your organization, a high-level official, depending on the structure, so a sheriff or someone else who is a higher-level official, in addition to some people from the program and implementation team. What we think is really critical is bringing people both from the law enforcement side and the mental health side to make sure that those partners are represented. So that way when there's places in this meeting to have some strategic planning time, you're able to really get that information in. For the national conference, we also recommend bringing law enforcement and mental health partners to that, and that is going to have law enforcement focused sessions. There are also some behavioral health training sessions available in that. So there's going to be grantees who are not just law enforcement grantees there. There will be partners from courts, from pretrial services, from community supervision, from jails, from prisons. So it's a broader opportunity to connect with people across the criminal justice system and really focus on different behavioral health diversion strategies that your jurisdiction can take.
Thank you.
Thanks, Sarah. This one is for Nikki. Nikki, when will we be assigned a technical assistance provider? When will we be getting a copy of the planning guide? And just in general, what are the next steps?
Thank you, Talia. Good question. So we're in the process now of assigning technical assistance providers. And within the next 2 weeks, you will be hearing from your TA provider to schedule your first check-in call. Your first call with your TA provider will be either in December or January, and on that call, your TA provider will provide you with more details on the process of our technical assistance and the approach we will be using while working with you throughout the 12-month grant period. The planning guide will be shared with you on your second monthly call with your technical assistance provider. And on that call, the technical assistance provider will again walk through what we're hoping to achieve with this planning guide and talk about strategies for completing your planning guide. All Category 2 grantees will have to complete the planning guide by the end of your grant period. And we're hoping for it to be a really interactive process with your TA provider. We've designed the planning guide to be very interactive and a process where everyone will be learning.
Thank you, Nikki. This one's for Linda and Gary from Alamance County. Does Alamance recommend any steps to ensure staying within PMHC from the very start, early in the planning process phase?
Would you repeat that question,
please? Yes. Does Alamance County recommend any steps to ensure staying within the PMHC from the very start, early in the planning phase?
So I think it's just any recommendations that you might have in the early planning stages for the PMHC, for police mental health collaboration.
We talk about having key champions, if you will. So that, to me, is very critical, and that they're sitting down at the table together from early on As we said, we started basically with a county resolution to be a stepping up county in 2015, August of 2015, and by January of 2016, because of the critical players being a commissioner and the sheriff and key leaders in the county, they had already put together a leadership team. So I think that is certainly one thing I would say, and frequent meetings of that team. Once you put together a team, you know, being very thoughtful and making the commitment to regularly meet and plan, to me.
Yeah, I think the other two things that I have are, one, getting on this baseline data collection as soon as possible. And I think that those four questions about folks, you know, coming to jail, staying in jail, recidivism, and connected to services, those are really key for us. And I think, again, getting clear on what those goals are for you and getting that baseline data as soon as possible, I think is really helpful to both to continue to sell the grant and sustain the work. And the second piece I think that is really important is start your work by thinking about sustainability. And so, you know, as you begin, don't wait for sustainability to come at the end of this. Start thinking about sustainability from the get-go.
Thank you so much, Gary and Linda. That was very helpful. For the next question, I'm going to give this to Sarah. When will the strategic planning in-person meeting be held? And also, let's start with that one. When will the strategic planning in-person meeting be held, Sarah?
So we're coordinating with the Bureau of Justice Assistance and trying to finalize dates right now. And certainly once those dates are finalized, you all, the grantees, will be notified. But we're looking at late February, early March for that in-person strategic planning meeting.
And the other one is, how do we know when to go to our technical assistance provider from CSG Justice Center versus going to our grant manager from Bureau of Justice Assistance?
That's a really great question, and I think for those who haven't received grants before, it can feel a little confusing to have multiple points of contact. Your technical assistance provider is really to help you implement the program as laid out. So in this case, take you through the strategic planning process for the police and mental health collaboration. And your grants manager helps with the oversight of your grant, and they're called state policy advisors at the Bureau of Justice Assistance. And so anything related to your budget clearance, or if you're actually making programmatic changes that would require a grant adjustment, that would have to go through your grants manager at the Bureau of Justice Assistance, but they would expect that you would have already coordinated with your technical assistance provider. So the grants managers and the TA provider actually sometimes, if there's a question, then they'll loop back in the other person to make sure everyone's on the same page. But one way to think about it also is no wrong door. If you have a question, you know, we'll definitely direct you. The TA provider can help direct you to the right person, so you can always feel free to ask, and we'll make sure that you get to the right person.
All right. This question for Nikki. When do you anticipate grantees to go on site visits? Who selects which programs to visit?
Thank you, Laura. Really great question. For the Category 2 grantees, we actually do not do site visits for these grantees. We typically do site visits for Category 3 grantees. However, we will make peer-to-peer connections with our learning sites, which we mentioned earlier. And there is a possibility if a JMHCP grantee wants to learn from a learning site, they can work with that learning site to do a site visit to that site. But in terms of technical assistance, we will not be doing site visits for the Category 2 grantees, largely because of the time frame, and we're only with you for a month, and so that won't allow us to do that.
Thank you, Nikki. This one goes to Maria. Maria, when will we get budget approval? What do we need in order to get that budget approval? And will we be reimbursed for activities prior to budget approval?
Okay, that's a very good question. So in terms of when your budget will be approved, that really rests on how quickly you may address all your special conditions. Your special conditions are the conditions that are listed when you accepted your award. There are standard grant conditions, but then there are some specific withholdings, sometimes specific to the Justice and Mental Health Collaboration Program. One specific withholding we had this year, it was based on some new policy around where you've got to submit a paragraph to sort of amend your narrative to talk about how you're going to address the opioid epidemic. So that's kind of a special withholding this year. So having said that, once all those withholdings and special conditions are satisfied, and also ensuring that all your calculations are correct, it's got to go through a several layer sort of process to be approved, but it can take about 2 months or so. That's kind of a rough estimate. I'm hoping everybody's going to be approved by the end of November, early December, because for this category of grantee, Category 2, your budgets are relatively small and they're limited to planning. So I'm hoping that will help to expedite your approval process, and I'm hoping that it'll be even sooner than that. Hope that answered the question.
Thank you so much, Maria. That's very helpful. Additionally, we have a question about the learning sites. What are they? And also about a link to the PMHC toolkit. I am going to pass it over to Nikki to give a little more information about the law enforcement learning sites, and also Olivia is going to send you all a link on the WebEx to the learning sites and to the PMHC toolkit. Nikki, any more information about the learning sites?
Sure. Just to reiterate what I said earlier, this is a program that started in 2010. And during that time, and now as well, we're hearing a lot of information, a lot in the media about the communication between police and people with mental illnesses. And this was an opportunity for the BJA, along with the CSG Justice Center and other subject matter experts, to select agencies that we thought were exemplary programs, police mental health collaboration programs. These agencies we use for peer-to-peer learning. We know law enforcement likes to hear from and learn from law enforcement agencies, and so this is a wonderful opportunity for agencies that, again, are starting a program or trying to enhance a program to not having to reinvent the wheel. So we make the links to the law enforcement learning sites. The agencies are located throughout the country, and they represent a diverse cross-section of perspectives and program examples, and are dedicated to helping other jurisdictions improve their responses to people with mental illnesses. The 6 learning sites, as I mentioned earlier, can indeed host site visits from interested jurisdictions and other local and state government officials as well. They answer questions from the field, and they work with the CSG Justice Center staff to develop materials for practitioners and for community partners. Just a reminder, the 6 learning sites are Houston Police Department, Los Angeles Police Department, Madison Police Department, Portland, Maine Police Department, Salt Lake City Police Department, and the University of Florida Police Department. We're actually now in the process of expanding the Learning Sites program to add an additional possibly 4 more learning sites, just to round out our team and make it a little more diverse to respond to the multiple calls and requests that we're getting in on a monthly basis.
All right, question. Will this link be available?
Oh, sorry.
Yes, the link.
I think the question is
the link will
be. Go for it.
The link.
Yeah.
The link to this webinar will be available, and the link will give you a recording of the webinar as well as a PDF of the slides. We also have in this webinar a link to the previous webinar that was on November the 1st, which was a general webinar for the FY17 Justice and Mental Health Collaboration grantees. And that link will be shared with you as soon as it is available as well.
Thank you, Nikki. And also that link, so once this webinar is up, you saw earlier there is a slide to that previous webinar, and the link is already there, so you can get that way too. But yeah, all the webinars will be up. Nikki, that is it for the questions that we have. Thank you very much, everyone.
Thank you, Talia. Just one more question, sorry, that came in. And we understand, someone asked why so late on giving us this information. This is a 12-month grant, and we're losing 3 to 4 months off it. Is there any way to get started? No. And I just wanted to encourage us to not get, we have kept the time frame in mind as we're going through this process. The information Maria gave earlier on the budget as well is a big part of that, and the approval of the budget. So we have kept the 12-month time frame in mind, and the technical assistance strategies that we have outlined earlier have also kept that time frame in mind. So I understand that people are getting anxious, but I encourage you to just realize that it will work out in the end, and we will work with you throughout this 12-month process. One thing to note as well, while we're meeting with you on a monthly basis, we are available in between those monthly calls. So at any time, if you feel the need to reach out to your technical assistance provider between our monthly calls, you also have the opportunity to do that. Thank you, Talia, and thank you, Laura, for fielding the questions. Thank you, Sarah and Maria, and Linda and Gary as well for responding to those questions. At this time, if there's nothing else, I want to say thank you to all the participants who were able to join us on this call, and we look forward to working with you again. A huge congratulations. You have been awarded a grant, and that is the very first step to a wonderful year together with your technical assistance providers. Thank you all, and have a good one.